I want to review some numbers for you, just to give you a sense of where we are. 1 month ago, yesterday, we had a total of 500 inpatients in Alabama hospitals with COVID-19. That was on July 19th. Yesterday, on August 19th, we had 2,764 people in the hospital, with almost 100 more who were suspected of COVID and were awaiting additional testing. That number from yesterday includes 50 pediatric patients. The number I saw yesterday is that 9 of them were ventilator patients here in our state. These are the highest numbers that we have seen for pediatric admissions since the pandemic has begun. As I mentioned to you, we have a negative net negative capacity for ICU beds. We have more people assigned to ICU beds than there are physically beds, and of course the way that happens is that hospitals are forced to have makeshift space for these patients, where they take a regular room, a hospital room that's not an ICU room, and convert it into that, or they leave patients in the emergency department, or they create space for patients in a hallway or some other non-clinical space. That is a little bit regionalized in a way. That is to say that we are still seeing the crush of these patients in the southern parts of the state, although we have very high numbers in some other parts as well. There are some beds that are literally available in some parts of the state, although really almost single-digit numbers. They're virtually none. But because of the huge crush of patients in southern Alabama, that's how we come up with that net negative capacity overall. COVID deaths continued to climb. We have a delay in reporting deaths officially because there's a whole death certificate process, and we normally allow for about a month to get that data submitted to us. But we do have reporting from hospitals of deaths that they are seeing and reporting that we are in the process of confirming. There is again, so these are unconfirmed numbers, but just over the past week we see numbers of 56 deaths yesterday, 43 the day before, 45, 36, 43, 32, 34. A few dozen to several dozen deaths a day has been normal now for the past couple of weeks. Unfortunately, Alabama has passed the 12,000 total deaths overall, which is a very grim milestone, and one we're not very happy about. I think what's most discouraging about these numbers, all of these numbers, is that because the severe illness and virtually all the deaths are occurring in unvaccinated people, we feel like this is preventable. These people did not have to die. These people did not have to be in the hospital, and vaccination would have prevented most of that. And that's extraordinarily frustrating for us. It's incredibly sad for the families, for the loved ones of these people that are no longer with us. We are seeing increasing numbers in our pediatric population. I mentioned hospitalization just a moment ago. By comparison, last year, schools were beginning last year, although certainly many of them were beginning virtually, but in the first 18 days of August last year, 2020, we had about 1,831 cases of COVID in the 5 to 17 age bracket. That was last year, 1,831. This year, in exactly the same time period, August 1st through 18th, in that same 5 to 17 age bracket, we now so far have 8,462 cases. So that's about looking at it, roughly almost 4 times increase in the number of cases that we've seen as kids are getting back to school. We don't have an easy way to correlate that with who's in person and who's virtual, and certainly not every person in that age group might be in a school. Even there may be reasons that they're not. So these are not school numbers, but these are just age group numbers. And you can see that we've seen a huge spike in cases over the last year, which we attribute largely to the infectivity of the Delta variant.